and which is true. It's I've spent more than 12 years in coaching, and my coaching has journey has kind of changed a little bit and diversified and then focused again and then changed. So it's always good to follow your interest when it comes to coaching and not really, focus on one area and think that's it. So as you mentioned, I started with children, well, first life coaching, and then children coaching, and then I went into uh, more youth, and I'm currently coaching as well youth because I work in Zayed University and I'm a professional development coach there. And but my passion, which is what we're going to talk about today, is health and well-being coaching. It's something that I've been so passionate about, and I've experienced firsthand what health and well-being coaching can do to a person. So, from my own experience, coaching has helped me heal a lot of issues, things that related to lifestyle and being out of balance with your body. And it also helped a lot of my clients get back into balance. So this is a beautiful way to give back, to the community and help people really understand and reach their potential when it comes to health and well-being. So I will share my screen now. And before I do that, I also want to thank you all for being here. And also thank you for taking the time to really invest in yourself. Because, we all have very busy lifestyles. And, it's not always easy to come and, spare some, hour to our development. So thank you so much for being here. So our lecture, not lecture, but our talk today is about optimizing health and well-being through coaching. And we're going to talk about why is it important, and the reason why health and well-being is so important is because now with the current lifestyle, very busy lifestyle, everybody's getting out of balance, right? So we all have very high stressful jobs and also poor lifestyle habits. A lot of us don't have time to exercise, don't have time to sleep well or eat well sometimes. And there's a lot of environmental impacts that really affect our health. There's also relationship struggles, there's also spiritual unawareness, and all of these things really come into play when it comes to our health. And so it's very important to really find a place where we can really focus on our health. And the health and well-being coach is the person who can support you with that, right? So today we're going to talk about what is health and well-being coaching and why is it important. And then we're going to go into a health and well-being coaching model that I use with my clients. And it has really proved to be very effective to the point where I mentioned I'm doing my PhD in natural medicine. I'm going to use this model to actually do my dissertation. So what is coaching? Like when we look, we all know that coaching, according to ICF, is partnering with a client in a thought-provoking and creative process that inspires them to maximize their personal and professional potential. So this is the ICF definition of coaching, right? Every person understands it in a way that works for them and their clients, and they kind of work with their clients to maximize their potential. So how is health and well-being coaching different? So it's a little bit similar because we do focus on, the use of thought-provoking conversations. And sometimes we include clinical interventions, especially if the person, the coach, is a licensed professional. And we use strategies to actively and safely engage clients or patients in lifestyle and behavioral change. Okay, so this is what health and well-being coaching is. And of course, a health and well-being coach is the person who observes, and I will talk about observation a little bit in detail later. And the health and well-being coach is also a cheerleader and guide and partner. So they really help their client to achieve long-term lifestyle changes, not short-term changes like the current healthcare model.
Excuse me, may I interrupt? I think your screen has not been shared. Are you sharing a presentation or what?
Yes, I am.
No, we can't see it. No.
We can see it. I think I can.
You
I
can?
think we can, yeah, we can see it.
You can see it?
We can
Yeah.
see you,
See it.
but you're sharing some presentation that I can't see. I don't know what's wrong.
I'm so sorry. Does
Mukhtar,
everybody else?
if you can look at the top of your Zoom line, and there might be some other screen that you might have opened.
All right, I'll check up. Sorry to interrupt. Please carry on then. Okay.
It's okay. It's important to see.
Yeah, sure.
All right. Okay. So, so why health and well-being coaching? And there's various reasons why it's important, right? So, how many? I mean, you can put your hands up, or you can, share if you like. If you've experienced a health issue that you went to the current healthcare or allopathic medicine, and then you discovered that it's very limited, so it can give you a short-term medication or short-term help, but you have to struggle or live with your issue for the long term. So this is one of the reasons why health and well-being coaching is important, because it closes the gap between the doctor and the patient. Doctors are very busy at the moment, and they don't really have a lot of time to spend on the patient. So the maximum you get is like 5 minutes usually. But the patient needs a lot of support. And this is where the health and well-being coach comes in. Also, it's important because we encourage through difficult times. So most of us experience lifestyle changes, birth of a child, and also death of a close person, and work changes. So we always experiencing different things in life, and these things can have a toll on our health and stress level. So a health and well-being coach is there to support people in these lifestyle changes. They also help people with chronic disease. So for example, people with high blood pressure, cholesterol, diabetes, all of these illnesses are chronic. So it's not short term, it's like people have to live with it, right? So a health and well-being coach can also support people when it comes to these illnesses, chronic diseases. Also prevention, which is very, very important, right? Because the first step to health is prevention. We don't want to get sick. We prefer to be healthy rather than be sick. So prevention is very important, and this is where we help people optimize their health. Emotional support as well, because emotions can really create a lot of stress. And so, it's important to talk to someone who can listen and observe and support when they can. In the corporate world, stress management is one of the key areas where health and well-being coaching comes in. And currently at our university, we're actually running a wellness program, because a lot of people do struggle when it comes to manage their stress. They're unable to manage their stress, and sometimes they get to a point where they get to overwhelm and break down. And finally, establishing healthy lifestyle habits. So all of these things are the reason why we need health and well-being coaching. This slide is so important, and it talks about observation. So observation is key when it comes to health and well-being. And the reason for that is when you think about, according to quantum physics, right? Everything is in the potential field until that potential collapses through observation, and then it becomes actuality, right? So observation is what we do as coaches. Really, if you take away everything else that we do, observation is the main thing that a coach does, right? We observe what the client feels, we observe their energy, we observe what they're saying, their words, that the choice of words that they use. We observe if they're happy, if they're sad, everything about them. This is what we do in a coaching conversation, observation. And we feed back that observation. This does not really happen in the current healthcare system, because the doctor is so busy, with other clients, that they don't have time to observe. And when it comes to observation, one thing is really important to notice is, what are we exactly observing, right? Yes, we are observing everything about the client, but are we observing potential, or are we observing weaknesses? Are we observing health, or are we observing disease? What are we observing? There's a study that one of my colleagues in my university did for her dissertation, and that study was all about observation. And in this study, they noticed that when someone comes in the door to a doctor's clinic, they did 3 trials. Research. So one person, certain people, they divided 3 groups. One group, when they come into the doctor's office, the doctor just leaves, without saying a word, and just let them wait for 10 minutes and then comes back. In another group, they gave them a form to fill out, and the doctor asked them to fill that form and went out again. And then in the third group, they gave them a form, but the doctor sat with them, and the form was based on their goals, their health goals, rather than what they're experiencing at the moment. So they noticed that after that, that most of the third group, where the doctor sat with them, took the notes and asked them about their health goals, those are the groups that got well very quickly. So first of all, that was the group who, by the end of, the appointment with the doctor, felt much better, and in a very short time got well. So this is how you see how important observation is when it comes to dealing with anyone, in the healthcare system or in coaching. Okay. So what does a health and well-being coach does when they focus or they observe? They focus on prospects. So we're always looking at what the client can do instead of what the client cannot do. Okay. We're looking for, it's goal-oriented. So we're always looking to understand what they're putting for themselves as health goals, rather kind of avoiding a specific disease that they're going, or health situation that they're going through. And of course, there's no diagnosis. And diagnosis is one of the things that really create a negative impact when it comes to health and well-being, because a diagnosis can really impact the client because they believe it. It becomes part of their belief system. So not diagnosing is really important, right? And then we always look for the root cause. Okay, so we look at what is creating the situation. Okay, and always long-term change. So nothing short-term, not take a magic pill and get better. No, we're looking for the long term. You know, how can you get better in the long term by applying and reaching your goals and focusing on prospect? And it's really clarifying for the client. So it's by observing and by coaching the client, you actually making it very, you're creating clarity. So the client is kind of understanding the situation in a much better way. And by understanding their situation, they're able to become more resourceful and reach their potential. So a health and well-being coach, or a coach in general, we always look at the client as whole and resourceful. You know, we're not here to solve their problems. We're not here to, heal them. Okay. So a lot of people, call themselves healers. The healer doesn't do anything. It's the healee that does all the work, right? Okay. So now if we look at this model, which is quite a simple model, and it works very well because it kind of targets every step of the client's journey towards health. So you start with awareness, okay? And awareness is very important because awareness is where the client understands what the situation is all about, right? And when it comes to awareness, there's a few things that we do as coaches. We do an intake form, for example, and in the intake form is like taking intake, but based on their goals, their health goals, rather than on what is going on, how bad they feel at the moment. We listen to the client. We check on emotions, ask them about their emotions, where they're coming from. And we use exercises, surveys, questionnaires, etc., to create more clarity. And of course, ask questions, because this is what coaches do, ask questions. And we also help them sometimes to look for a third party, so kind of, disconnect from their situation and look at it from, above, like a helicopter view. And one way this is a very simple exercise, right, that a lot of people use as coaches, which is the health, it's not the health wheel, it's the life wheel, right? And we can use it for anything, really. I use it sometimes when I'm coaching executives. I use it like for career goals. I use it sometimes like when there's a leadership program, so you can use it for a lot of things because it's very powerful. And what it does is it helps the person look at their situation from above. So they're not stuck in it and they can't see where they're going. They're actually looking from above and they're seeing what is causing, where is the root cause of their issue, right? So they look at the environment, they look at movement, they look at, spiritual awareness, fun and enjoyment, anything related to health, right? Diet, exercise, mental health, stress, even relationships. So this is the first step, which is awareness, okay? And I'm sure that, experienced coaches have a lot of tools in their tool bag that they can use to create awareness. The second step is need for change, or the goal, right? So we know that most people, when they come for health and well-being coaching, they want to get better, right? But what does that mean? Need to change. need to get better. So we really need to understand the reason why they want to change, why they want to get better. There has to be a very compelling reason for change. Otherwise, a person will not change. Someone who, there's a lot of people who want to quit smoking and they spend like years trying to quit smoking, but they don't. They always go back to it. And it's not because of addiction, right? It's because they don't have a compelling reason to change. So as a health and well-being coach, we help people establish a compelling reason. And there's, of course, exercises that people can use, coaches can use. One is the 7 levels deep, going deeper and deeper until you understand why that person wants to change. And also linking it to values, right? Because sorry?
No, please carry on. This was just a...
Oh, okay, sorry. Okay. So setting SMART goals, because a lot of people don't know how to set SMART goals. So they want to change, but, it's like out in, up in the air. So we support them set SMART goals. And of course, again, ask questions. What do you want? What will get you? What will that get you? What are you hoping to gain? So SMART goals are very important, because if you don't have a SMART goal, then, nothing is really very clear to you, right? So we help people do that. The other thing is values. So as I mentioned, we link their need to change, their compelling reason to change, with their values. So for example, someone, if we try to dig deeper until we find the value that connects to the change. Okay. Do you have any questions so far? Right? Because as coaches, we're always really, what we're looking for in a coaching conversation is what their belief systems and their values, right? Because these are the most powerful things that make people do what they do. Third is reflection, understanding beliefs and root causes. Okay. And here we try to help people understand their limiting beliefs. Okay. So for example, there's some people will have a belief that, you can't leave anything in your plate. So they overeat just so they don't feel bad that they left, something in their plate. And that can cause, overeating, obesity, etc. Another belief system is cancer kills, right? So a lot of people, when they get diagnosed with cancer, it becomes part of their belief system. And so it is really what kills them at the end, not the cancer itself. And then another, belief system is you have to live with chronic or autoimmune disease, right? For the rest of your life. Because it's chronic, you have to live with it, which is, it has been proven incorrect. Okay. Another belief is I have this, so it becomes like the disease becomes part of their identity. Okay. And these are the things that we kind of reflect on and kind of try to shatter a little bit. So asking questions like,
question, no, quick.
Sorry?
A quick question. In fact, someone, Mr. Arshad Akif has asked it. Can I ask that question? In the chat box, basically, there is a question. So
yes, please ask.
okay, the question by Mr. Arshad Akif is that can we say coaching aims at long-term well-being, creating or managing a balanced life, and it is not short-time healing thing?
Yeah, of course, because because coaching, what coaching does is it changes a belief system. Once you change a belief system, you can't really go back to it, right? So it changes something very deep for the person. Okay. So if, for example, I believe that, like, for example, this is a situation I faced, right? Which is I have Hashimoto's or thyroid disease, and I have to live with that for the rest of my life because it's incurable, right? And the moment that belief was changed to, no, I can heal from Hashimoto's. I don't have to live with with an autoimmune disease. Then there's no way I can go back to it. Even though if I get the same disease again, this time I know how to heal it. Okay.
Okay. So based on this, I mean, this is my question now. I mean, this is a very good thing that on belief that you have mentioned. Does it mean that the belief about many other health issues that people usually have, for example, in our part of the world, blood pressure or diabetes, I mean, these are again few things which we believe that they are genetic also. So,
Yeah.
in terms of the genetic diseases, does this formula work for that part also?
Yeah. Unfortunately, we've been misled a lot by modern medicine. In fact, only 2% of all diseases are genetical. So, when you understand that, then you know that, oh, I can actually, this is not genetical. My genes don't determine my health. I determine my health. And there's something called epigenetics, which is above the genes, which is actually based on your stress levels, so that what epigenetics does, it's a science. It kind of helps the genes express or not express, okay, based on the environment. So, we always see, that image of a fish in a bowl, right? So the fish is healthy if it's in a clean water, but if it's not healthy when it goes to like muddy water, right? It catches disease. And this is exactly how our bodies work. And beliefs are very powerful. So the moment you change or you help someone change their belief about something, they're on the first step to healing. So questions we can ask is, how true is that belief? What makes it true? What makes it untrue? Has anyone proved it untrue? Where did you get that idea from? How has this belief affected your health? How can you let go of that belief? Okay. So,
Yeah, Bakhtiar sir has some question, I think.
Yeah.
Bakhtiar sir,
Sorry?
you need to unmute.
Sorry, I was mute on my question is where there is a disease that a person is suffering from, a serious one, and he or she is seeking medical care from healthcare professionals, or some mental disease which is being cared by professional therapists and so on. So along with those other healthcare professionals, can a coach also get involved if asked for? And how does that integrate the process?
Yeah, of course. So coaching is not trying to convince someone that they don't have the disease or that they shouldn't take the medication, right? Because that will be interfering, that will be guiding, that will be advising, that will be, consulting. We don't do that, right? We don't do that as coaches. We don't do it in corporate coaching, career coaching. We never advise. So when we have a client that is also seeking, medical or undergoing medical intervention, our role is to really understand, what is their goal and how can we get them to their goal. So their goal could be, I want to get off blood pressure medication, right? This is not my goal. Of course, we always refer them, ask them to ask for medical advice, but we support them in, asking them, in coaching them through it. Okay. So not advising, not providing medical advice at all.
No, let me give you an example. The contract that I use with clients has a clause. If you are undergoing therapy, we want you to inform the therapist that you also want to undergo coaching, something like that.
Yeah, I guess you can do that. Of course, you can do that. Yeah, definitely. I mean, you have to, it depends on the policies and the regulations in your own country, right? But it's good to have a clause like that, of course, because that will be protecting yourself as well as a coach.
Thank you.
Okay, because like clients sometimes they will stop taking a medication and then they say the coach told me, and we don't want that because we're not medical, we're not licensed professionals unless the coach is also a doctor where they can provide medical advice, then it's a little bit different.
Yeah.
So imagine, if all doctors, nurses, healthcare professionals become coaches. I think that will elevate the healthcare system a lot. I know we don't have a lot of time, and I want to be mindful of the time. So I'll just go over emotions very quickly. Part of the reason why we talk about beliefs, because beliefs turn into emotions, right? When we believe something, it's or we have a value, a specific value. That value, when it's being broken, it can turn into an emotion like anger, right? If I believe, if I have a value that respect. If somebody disrespects me or others, then that could turn into anger. So this is how we connect also, how we, the values, the beliefs into how they affect the body. And this is an image of how emotions affect the body. So in Chinese medicine, this is well known. And I think in a lot of the ancient medicines, this is a well-known fact that they understand the connection between emotions and disease and how it affects the body. The number four is options or plan. And here we support the client to create their own plan, right? So we're not telling them, we're not advising, we're just supporting them using ICF competencies, how to create their own action plan, how to move forward. If the person is a licensed professional, healthcare professional, then they can even do some advising and mentoring and educating. So, for example, like if the person is a dietitian, then they can provide education and mentoring about what food to eat, what not to eat. So this is where that comes into play. But other than that, if you're just a health and well-being coach, then you just stick to supporting the client create their own plan. And it takes us to the next point, which is action, right? And this is the hard bit because clients, okay, they went through the journey, they understand everything, they have created awareness, they know the need to change everything. But now, because most of our lifestyle, we call it lifestyle habits, are habits. So habits are things that we are, we kind of do without thinking. So a health and well-being coach is someone who also support their clients change their habits and see what is working, what is not working. So for example, someone who smokes or overeats, that's where we start coaching them into creating a new habit that supports them with their health goals. And of course, there's a lot of books about, building new habits. I won't go into that because I'm sure that most of you as professional coaches and experienced professionals, you've probably read a book or two about, creating habits. So an example, for example, to give you about how to build habits with clients is, if somebody wants to take on an exercise routine, so they might say something which is, I will exercise for 30 minutes, 5 times a day, right? But we help them create a SMART goal. So the SMART goal will be, when, where, how, with who, what reward are you providing to yourself? And then we monitor their implementing that new habit, and what are the challenges in the implementation. So we coach them on that. Exactly like you would coach an executive who is kind of put down a goal that they want to do, and then they didn't adhere to their goal. And finally is feedback, right? So everything has to go back. Everything in life is a feedback loop, right? So even health, because health is balance and it's like reaching homeostasis. So there's always a feedback mechanism ongoing in our bodies. And based on our behavior, our habits, our beliefs, our underlying root causes and belief systems, the reason, our awareness, it kind of comes, it plays out. So going back and understanding why something is not working out for the client is key, because this is where you get them to the long-term change. And with this, I end. So these are where you can find me if you like to take a picture of it or to, write it down. And I will stop sharing.
Thank you very much, Dana. Lovely to have you with us, and it was really wonderful. Few of the old things just popped up in my mind. I mean, few very important messages about belief and the compelling reason. So that's one very important takeaway. So anyone, if you have any questions, please go ahead. And G, please, if anyone wish to ask any question, the floor is open and
Yeah,
you can
I have a question. So thank you very much, Dana. I was just writing the comment that it's great to see that coaching has expanded beyond just what we know about coaching or the traditional coaching to health and well-being. I guess my question is that, is there any kind of is it a time bound or it is a lifestyle, this type of a relationship between the health and well-being coach and the coachee? Thank you.
It can be time bound if depending on the client, So I have clients who've been seeing me for years, and I also had clients who saw me for like 6 months, and then that's it. But because we're human, so we always have challenges. So just like any other coaching, sometimes you find you work on a certain challenge, you overcome it, and then you're okay, But sometimes, people continuously want to talk, but it's not meant to be a dependency on the coach. No.
Can I ask another question?
Yeah.
Thank you very much. It's a very nice presentation. And the slide, the master slide that you have from awareness to feedback, it's quite similar to the way we do other coaching. I'm mostly doing executive coaching, but the framework is similar. Do you have a name for this framework that you use?
No,
Or
I
model?
don't have. It's just a model that I've used, and yeah, you're correct. This is very similar to what we use as coaches in executive coaching, because change follows a similar path, right?
Yeah.
So
Yeah.
yeah,
Okay.
from awareness to kind of feedback and creating a habit.
Yeah.
I just want to say one thing, Dana. This was very, very interesting, very nice presentation. And I think so one of the things which really stood out for me was the fact when you're talking about the need and the compelling, kind of reason or establishing that need, the more, if you want to defy gravity, there has to be some kind of force to defy that gravity. And I think so that was very well explained. Thank you very much.
Thank you. Thank you so much.
Great. So
this reminds me, sorry, I do some work with Blanchard Coaching, and their SMART goal definition, the M stands for motivation rather than measurable or something. Their M is motivation, which I think highlights the importance, as Arkia, you were saying. Yeah.
Yeah. Motivation is very important when it comes to change. You're right.
So
thank you, Bakhtiar Sir, for sharing this. I didn't know, and this is very interesting take on it.
Yeah. I mean, my take was also about the compelling reason. I mean, we all have to have one very compelling reason to get up in the morning and do something that we really wish to do. So that makes us tick also. So thank you very much, everyone, and thank you very much, Dana, for this wonderful presentation and for taking out time and being with us. For all of us who have been today with us, and our next session will be on February 21st, which is not the last Friday. It is the second last Friday, in fact, because on the last Friday, perhaps Ramadan will be setting in. So what we have set is the second last Friday, which is February 21st. We will be sharing the information about the session as well. And that session will be very interesting. The topic would be mastering financial success as a coach. So our next speaker will be someone who is not only a coach, but also a financial guy. So he will be sharing with us the financial success as a coach. So that is the next one. So thank you very much once again. It is lovely having you all here with us. And if there isn't any further comment or question, we can collectively say thank you to Dana. And
I have an observation. Sorry, Omar, I think we still have some time. We were talking about this earlier, that we want to encourage all the coaches who are doing coaching, even if they are not ICF members or ICF credentialed, to come to these sessions, which are basically spreading awareness about coaching and so on, and also highlighting the importance of becoming members of ICF and going for training and credentialing. So what all of us who live in Pakistan want to do is to find those coaches who are conducting coaching sessions. Some of them are doing good work also, and encourage them to come to these sessions, and so that we can spread greater awareness among Pakistani coaches.
Perfectly said, sir. Thank you very much. Wonderful.
Thank you.
That's one of the objective also. We all those who are here and they want to know about the ICF coaching, the membership process. I have shared numbers also in the chat box, so you can contact us for any further information. So thank you very much, Bakhtiar sir, for raising that point. And anything else, Dana? Very crisp and very good.
For having me today.
Thank you very much, Dana.
Thank you.
Thank you very
Thank
much.
you.
This
Thank you very much.
program is recorded also.
Allah
And we'll be
Hafiz.
sharing the recording as well. Thank you.
Great.
Thank
Take
you.
care.
Bye-bye.
Bye for now.
Khuda Hafiz.